But it's really, really great to be here. And I'm sure we're going to get some more people coming on here in just a little bit. But I wanted to introduce myself first to our first ever online health empowerment weekend. We're so excited. And my name is Steve, and this is Sue. We serve with the Burlington Church of Christ, and we just feel so honored to have our guest speakers and our guest presenters in for this weekend. Last night, a couple of sessions today, and then some who are going to be able to make it tomorrow morning. But but I wanted just to make note of how powerful last night was. We kicked off last night with a roundtable discussion entitled "Surviving and Thriving in Medical School," and it was a really great crowd that came. It was facilitated by our own Dr. Margaret Tando, and she just did a terrific job. It was it was joined by Dr. Broyles and Dr. Williams and Dr. Gill, and I'll tell you, it was epic. It was truly empowering, which is what we were all hoping for, but it kind of went beyond even our expectations and our hopes. It was not only health empowering, it was life empowering. And it talks about in Proverbs chapter 4, it says that wisdom brings health to our whole life. And wisdom brings health to our heart. It brings health to our mind. It brings health to our spirit. It brings health to our physical body. And honestly, I just felt like it was sort of a masterclass. We were sitting in someone's living room, just talking about experiences, talking about, just different strategies, talking about the heart, talking about real life and how to really excel even in the face of adversity and even in the face of challenge. And so I just wanted to start by just saying thank you. Last night was really, really encouraging, and it was just this kind of inspiring beginning to a great weekend. And so today we have 2 sessions, and that are going to be really powerful. The first session is entitled "Global Health Awareness and How You Can Get Involved." And Dr. Kevin and Noelle Broyles are going to be speaking for us, and they're going to introduce themselves here in a little bit. And then also Dr. Mark Ottenweller, live from Starbucks in Delaware, is going to be speaking as well. And both of these couples have an extraordinary experience and stories to tell about service, servant leadership, and health empowerment around the world. It's going to be truly awesome. I can't wait. And then later on this afternoon, from 12:30 to 2, we're going to have another session entitled "The Sacred Journey of Self-Care." Dr. Marcus and Williams and Sonia will be speaking for us there, and also Dr. Chris Sharon and his wife Michelle, who is a wellness instructor with the Crosspoint Clinical Services. And so we can't wait for today. It's going to be amazing. Thanks for joining us. And Sue had a few words she wanted to share.
Yeah, just on a personal level, I feel just so thankful for the people that are speaking today. And I'll share about the other couples later, but from a personal perspective, just the honor, my son was in 8th grade in Connecticut, and he wanted to do something for the poor. And someone gave me the phone number of this woman, Noelle Broyles. And and she ended up connecting Nick with Kenya and Africa. And who would think 13 years later, she's my in-law, and my son ended up marrying her daughter. And then on top of that, Mark, not only does he care about global awareness, but Dr. Mark came and actually spoke with Nick several years in a row, came to his town, to his high school, to his middle school, to help Nick bring awareness to the less fortunate and the vulnerable children in Africa. And I feel like it's still having life-changing impact on us. And it really changed our lives, having the chance to have our kids be able to connect with global awareness. And my daughter is now a nurse at Children's Hospital in Atlanta, and a lot of it came from people like the people that we're going to get to hear from today. And so I just want to say, pass it on to you guys. We are so blessed to be able to have you guys with us today. So Thank you.
Thanks. And just a quick little piece of housekeeping. If we're going to just keep the line open for the speakers. And so if you're not speaking, and we'll have a little time for question and answer a little bit later on, but if you're not speaking, if you go ahead and please mute yourself, that would be great, so we can really hear clearly the people who are presenting today. So thanks so much.
Turn the reins over for the first presentation.
Yep.
All right. Well, Mark and Noelle and I are very excited today. Mark, are they bringing coffee?
Yeah, I get free coffee here.
All right. So Peter is helping. Peter, is this working?
You're good.
Okay. So Mark and Noelle and I, and Lynn wishes she could be with us, but she's with her mother right now. Are very excited to have this opportunity. Mark, you may want to mute just for a second. Very excited to have this opportunity to meet with you guys today and to talk to you about global health awareness. And I put health in parentheses because Steve reminded us that on the call today are folks that are not necessarily in healthcare. And it really doesn't change the message because we're talking about being aware of what's going on in our world and how can we be involved. And so while this will be medical, because the Ottenwellers and the Broyleses are medical, you can translate this, and Noelle will also talk a bit about what you can do in your own community, what you can do that's not healthcare related necessarily. So I put the health in parentheses for that reason. We're going to break this up into 3 different sections. And see, I took the health out, so there you go. We're going to tell our stories a bit as Mark and Lynn and Noelle and I kind of think about our past. We actually kind of eased into this, from an early age. And I think that's one of the teaching points that we'll share with you. We kind of eased into this, and then we found ourselves living for years in places like Africa or Bolivia. How did that happen? Certainly wasn't overnight. And then just how we can be aware of what's going on in our world around us. And then how can we be involved? And so we've kind of divided this presentation into three sections. And at the end of each section, we'll give you an opportunity for comments and questions if you should have any before we move to the next section. All right, and so we'll start off with our stories, and we're going to start off with Dr. Mark here. And Mark, you'll need to unmute, of course. And then Mark, you just need to tell me how to advance your slides. Okay, Mark? You're muted.
Yeah, I'll just say next, fine. But it's great to be here. I'm in Newark, Delaware, visiting Lynn's mom, and so we're on the road. And I got kicked out of a couple places, so I ended up here at Starbucks. So you may hear coffee grinding in the background, but it'll definitely have a community feel, the stuff we're talking about anyway. But it's great to have you on, and I certainly have worked a lot with healthcare professionals, doctors and nurses and social workers and different folks, but also with a lot of supporters and people that are interested in the work and want to promote issues around global health. So this is a part that's just kind of my story. Next. The work we started in Africa was in 1989. It was based on Isaiah 61. And you'll see the importance of that in a minute. But it says, the Spirit of the Sovereign Lord is on me because the Lord has anointed me to preach good news to the poor. He has sent me to bind up the brokenhearted, and a series of things. And then to comfort all who mourn, provide for those who grieve in Zion. Bestow on them a crown of beauty instead of ashes, oil of gladness, oil of joy instead of mourning, garment of praise instead of a spirit of despair. And they'll be called oaks of righteousness, a planting of the Lord for display of his splendor. And so this is actually how we based our work in Africa, based on this scripture, because we felt like we were bringing the best and the brightest people to work in the worst situations with great hearts, and it would have huge impact. And I'll explain that impact when we talk about awareness in a little bit. But this is exactly what we based our work on, this very passage. And so I encourage you to find something you can base your work on, and it'll inspire you and encourage you, even when times are very difficult, which certainly come. Next. This is sort of my history. I went to medical school, got board certified in internal medicine. I'm a fellow of the American Academy of Clinical Physicians and all that. But in 1989, I went to Abidjan and started the AIDS clinic. And then in 1994, I went to South Africa and worked with in Soweto, which is a large informal settlement. Co-founded a big partnership to help AIDS orphans and vulnerable children with Coca-Cola and Emory School of Public Health and Rotary International and some big partners. And I'll describe that again under global awareness. And then I had a global role with Hope, and then worked with development now for the last 6 or 7 years. Next. So that's my background. This is the clinic we started in Abidjan. It was the first AIDS clinic in West Africa, the Centre d'Assistance Socio-Médicale, right outside the big university hospital where they tested lots of people, had no real care and support for them. And so we love the fact that we started this primary care clinic providing psychosocial and medical support for people living with AIDS. And it was really the first one in West Africa. Next. This is my family. This is Diane and my 3 kids. They were 10, 7, and 3 when we went to Africa. That's kind of nice dress, sort of Sunday clothes for West Africa, but it was a great experience both for Diane and I and our kids. It was amazing. And I could talk about it for a year nonstop, just about all the things we learned working and living in West Africa, French speaking, very tropical, kind of wild and woolly, kind of great experiences, amazing time there, especially with the people. Next. This is kind of like, this is what you do outdoors. This is a marketplace where you're educating and talking about HIV. And here I'm talking to some young children. You get a lot of people gather when you're talking about HIV and other challenges like that. So we did a lot of street activities. We worked with a lot of people educating around HIV, and frequently children would gather and we'd have little special activities for them. But that gives you the feel of what the street's like in Abidjan. Next. This is in the hospital. This is Jennifer, my daughter. We'd go over once a week to visit the hospital to help the children there. And that's a little child infected with HIV in a big public hospital where there's very limited resources and tremendous needs. So I brought my children there and we worked with the children, and then the church got involved and grew and developed a great partnership with the local healthcare system. Next. This is some adventures we got to be involved in. The man kneeling on one knee is Mike Toliver. This is in Rwanda after the genocide, and these people are carrying all of their possessions across the border into Bukavu, into the Congo. And so we also got to do some relief work in places like Somalia and Rwanda and Ivory Coast and other places. Next.
My goodness, Mark, that does not look like Mike Toliver.
Yeah, he's a little different now. This is in South Africa. I'm a little dressed up a little bit more, and I'm working in a clinic. We did a lot of care and support groups, and then we supported the people living with AIDS, and then they went out and educated their communities. So it was a care and support program on a very large scale. We started in a clinic in the Ivory Coast. This was community-based work where we're working out in the clinics. There were 12 clinics. They did about 1 million outpatient visits a year in these 12 clinics in Soweto. And so I started a large network of programs there in Soweto in South Africa. And then we used those models in other sites in Africa. So it was a tremendous opportunity to really reach out to people and have impact. Next. We did some large community activities. This kind of tells you the type of things we did, especially early on AIDS prevention. So we did prevention, care, and support, and then we got involved in orphans and vulnerable children and early childhood development, which again I'll describe under our global programs. But this is the kind of activity we did when people were denying AIDS, when they refused to believe in AIDS, et cetera. And we had to do some very large-scale activities to raise the awareness, especially early in the epidemic. Next.
Where is that, Mark?
That's in the Library Gardens in downtown Johannesburg, right in the middle of the city. And so it's a Saturday morning program. Had a fantastic time. I also worked in Haiti. The man to your right on the screen is Marcus Williams, one of the other presenters. Went to Haiti with us in Baudry and did some work in the community. And they brought this young guy with sort of agonal breathing due to asthma. And someone had a bank strip of epinephrine and probably saved the guy's life. And so right there in the community working in a very poor area of Haiti. So we also did some relief work in addition to the HIV work we did in Africa. So we had a lot of interesting experiences, a lot of adventures, and challenging circumstances, but a tremendous opportunity to help people. Next. This kind of, to me, reminds us of our programs for little children, which we developed on a very large scale, orphans and vulnerable children. The woman sitting next to me is a real hero. Her name is Solange Balou. There are a lot of great staff and great management people that helped us develop these on a very large scale. Solange Balou was one of them. That's in the Ivory Coast, some large scale programs with children. The next slide is Mark Aguirre. He also was another real hero who helped to develop our programs for children. As we did prevention, we did care and support, then orphans and vulnerable children, then early childhood development, and that was really spearheaded by Mark Aguirre. So we had a great team of people working together across a number of countries to have the impact that we needed to have. Next. We also interact with wild animals. That's a cheetah. They won't bite you unless you threaten them too much, but that's a live cheetah. And so we got to do fun things as well.
Mark, did you Photoshop yourself into that picture?
No way. I didn't Photoshop nobody. There's another one of Lynn petting that same cheetah. I can show you a picture of that.
Oh, it's just an overgrown house cat is what you mean.
Yeah, exactly. Like a cat, just bigger, faster. Next. This is Hout Bay, one of the beautiful places in Cape Town. You get an idea that we had some beautiful places around Africa they also got to visit. So again, it wasn't all work. We had some great times as well. Next. We had some challenges across the top. You'll see pictures from the Ivory Coast during Civil War. I took those pictures and see the soldiers, the people. So some of our challenges were man-made. On the lower is the earthquake in Haiti. Some of the challenges were natural. And so we had challenges everywhere we went, but I think God blessed us in some incredible ways. I think you'll hear more about that. Next. We met a lot of great people, interesting things we did. I had tea with Nelson Mandela before I left South Africa. We spent a lot of time actually with him and his organization, and people like Oprah Winfrey come out to our program. So God blessed us with some incredible visitors, incredible contacts. Next. Remember my family in the Ivory Coast. This is my family now. So God also blessed us. My wife passed away, unfortunately, in 2007. And in 2012, I married Lynn and picked up a few more kids. And now we have 6 kids and 8 grandkids. And God's blessed us as a family as well. Next. That just gives you an idea about my family. When I left South Africa in 2007, I had breakfast with a number of dignitaries, including Nelson Mandela. But the most poignant time was a group we met with called REPSI, which is a regional psychosocial initiative. We helped them get their program started. And so they invited me for breakfast. And I'd been working there a while, got to know this group. They loved our programs and what we did. And at the end of at the beginning of the breakfast, the leader stood up. This is a non-religious group. But she stood up and read Isaiah 61, the very passage I showed you. She read that passage. I was totally floored. I didn't know she was going to do it. I guess she'd heard about it where we worked together. And she read that passage. She said, Dr. Mark, this is what we saw you and your team doing, binding up the brokenhearted. And we want to honor you and thank you for doing that. And so I think the greatest privilege we have is really living what the Bible says and living what Jesus did, and imitating him and having the impact that he had. And so I just want to share that as my experience in working with the poor to inspire and encourage you. That's my story. Let me turn it over to Kevin.
Thank you, Mark. I will take a moment in a minute to just kind of tie Mark's story to our story, because Noelle and I definitely have experienced the things we've experienced because of being inspired by Mark and the work that he was doing. And so there's the very deep connection. So I'll share with you just a little bit about the Broyles family. I'm a physician. Noelle is a former pediatric oncology nurse. We've been married for 35 years now. We've got 2 daughters and a son-in-law, and that handsome young man to the right. Don't get confused with the handsome young man to the left, which is me. The handsome young man to the right is Nick Schaff, Steve and Sue's son, who is my son-in-law. And we're very grateful to have him in the family.
I think that's called humanitarian nepotism.
All I know is we like Nick so much that when they were dating, we told Brianne, if you mess up, we're going to keep Nick in our family. So hopefully things will go well for you. And so anyhow, Noelle and I both were educated. I was at Florida State undergrad. Noelle was at the University of Florida, where she went to nursing school. I went to medical school at the University of Florida. And then we moved up to North Carolina. Noelle worked as an amputee nurse clinician up in North Carolina and as a pediatric oncology nurse. And I did my residency in family medicine, a fellowship in academic medicine, and then a master's in leadership at Duke. I went into private practice for 6 years. During that time, we had our first child, and Noelle made the very wise decision, and we were able to be full-time mom and actually really work closely with the school system and with our kids and with the things happening in our community, which very much influences where our family's been over the last 3-4 decades. I was at Duke for 25 years as a professor of family medicine and a medical director of urgent care. I started that at Duke and became a chief medical officer of the primary care division, and then began to work with Hope Worldwide about 11 years ago from today. I had volunteered with Hope, Noelle and I had, as local chapter co-directors in North Carolina, where we did things in our community for our community. And then missions deacons in Kenya, Africa, thanks to Mark and the needs in Africa. Then we became country directors, Noelle and I, in Bolivia, South America. And now we're back in the States 8 years later in Atlanta. And we are local chapter Hope co-directors here in Atlanta, doing things again. And so our lives have just been one of wanting to serve. I'm currently working as an urgent care physician in a large medical group, a lead physician in a couple of the practices, and I serve on the board of the urgent care. So that's a little bit about our history. We'll show you some photos that'll kind of bring you along. But in the same way that Mark shared Isaiah 61, Noelle and I wanted to share with you Matthew 4:23-25. Jesus went everywhere in Galilee, teaching in the synagogues, preaching the good news about the kingdom of heaven, and healing all the people's diseases and sicknesses. And when you look at the ministry triangle of Jesus, you see helping and healing, teaching and preaching. And I would say that this has been the theme of our lives and of the lives of people that we've tried to influence and the lives of our friends. Anyone who claims to be in Jesus walks as Jesus did. And this is what Jesus did. And so this is kind of what's led us through making the choices that we've made along the way. Hey, Noelle, unmute yourself. And did you have anything that you wanted to share at this point?
I'm good. You'll never hear that again.
Yeah,
But
I was
I'm
going to
good.
say that's quite rare. Okay. So we started our kind of, as I told you before, we were chapter directors in Triangle, and we did several things in Triangle, North Carolina, and had a thriving Hope chapter where we looked to find needs in the communities and to meet those needs with our volunteers. But the first time we went to Africa, we started going to Africa. We actually flew down to South Africa and asked Mark, where in Africa do they need help? And he said, well, I want you to go to Kenya. And so we went up to Kenya and just began to become, familiar with the work of Hope in Kenya, with the church in Kenya and the needs in Kenya. And this was the beginning. We took our kids with us. I think we made 4 or 5 trips with our family every other year for 10 days, and so we kind of started small, if you will. But this is one of the places in Mukuru, in Kenya, in Nairobi, where they had an STD clinic, and they had testing and a support program for orphans and vulnerable children. And a lot of this is because of Mark's work in Africa. And there was work that popped up all over Africa as well. And so this was the first time we were exposed to what I would call extreme poverty. The pictures at the bottom of the screen, you know, when you're there, you not only see this, but you feel it and you smell it and you taste it. And it had a powerful impact on me and my family, you know, to see kids behind, you know, fences like that because they're in school, and you know, and be able to see the kids with their school uniforms, many of them tattered because they couldn't afford that. But to be able to see the poverty, but to become aware of just the incredible resiliency in children, and to see their needs, but also to see the amazing gratitude for every little thing they had. And so I would say that we were so moved by our early experiences in Africa. And so we were so moved that actually we started leading a couple of groups to Africa during a couple of those 10-day trips, these youth corps, the volunteer corps. And we had groups of 30 and 50 that we took to Africa to serve. And we're all looking a little younger there than we are now. But it was an amazing experience to be with a group of people to serve overseas. It brought us close to each other and close to the needs, but it was an incredible experience. And I think our experiences in Africa are really what kind of set the stage for our next experience, which was, I would say, is our all-in experience. And so we found ourselves in Bolivia. I actually found that I was able to retire early from my work at Duke, having been there for 25 years. I went up to the leader of Hope at that time and said, "Hey, is there anything we could do overseas? Our kids have graduated from high school now, and is there anything we can do overseas?" And they mentioned about that they wanted to start a work in Bolivia. I thought Bolivia was in Europe someplace. And so I quickly was schooled and realized that not only did I not speak Spanish, which they don't speak English in Bolivia, but that Bolivia was in South America. So we took an exploratory trip in 2011 and met this most beautiful city that had the most incredible impact on our lives. This is La Paz, Bolivia. La Paz, Bolivia is at 13,000 feet. It's a city set in the mountains, around the mountains. And it's about 2 million people, and the poverty is just overwhelming in La Paz. Looks good from far away, but once you kind of get down and you see the poverty, this is a woman who lived there with, I think, 6 or 7 of her children. A husband is disabled. Her daughter was killed. Just these stories abounded. And so we came to Bolivia in 2011, and Noelle will talk about planting seeds, but the seeds planted in Bolivia grew to a significant work we did in health and a significant work we did in social services, or in social. And in health, we created a clinic where we provided healthcare as well as did education and training, and worked to support the social work that we were doing. We had the opportunity to take a house and remodel it and create a very beautiful clinic, which I miss to this day. And it was a wonderful place to practice medicine. And we taught lots of people and saw lots of patients. And these people that you see here are Bolivian doctors who had no opportunity to advance their future. They came and worked with us, and several of these people are gone to the United States to do specialty training now. And so it was a lifeline for these doctors in Bolivia who were just kind of stuck because of the healthcare there. And then we taught and started the first nursing assistant program to the top right. These were 2 girls. One was an orphan, and the other was one who had been abused in a very rough situation. And they became nursing assistants. And then at the bottom, we had our colleagues join us, like Dr. Chris Sharon join us. This is Chris came and did some work, showed about how to do sinus surgery, you know. And this doctor here is a pediatric doctor from Duke that came and was teaching how to do laceration repairs. And so, you know, we invited many people to come over the years to join us in the work that we did with health. If you came as a visitor, you might find yourself in all sorts of situations. This is one of my former roommates from medical school, Don. He's an engineer, just an innocent engineer. Well, we casted both of his arms and both of his legs because it was learning how to cast day. And so Don found himself in casts. Great learning experience, great teaching opportunity, and a great time by all, and a memory that Don will never forget. So we also just enjoy providing care in the community. And so we would have these park days, and this is me and a doctor from Bolivia working on a patient there. And then Noelle, I'm going to let you take it from here as you talk about the social programs that were developed. While I was working in health and working in the clinic and working with the medical folks, Noelle was working to develop social programs in Bolivia. And I'm going to let her share about that.
Well, this is like quite a historical moment that I'm not going to take a long time to share. So this definitely needs to be documented in history somewhere. But I think what we will talk about a little bit is, you know, Kevin and I really didn't speak Spanish. I might have spoken a few words. Kevin had, therefore, he had a translator with him all the time because of his medical, you know, the intimacy of words and medicine. And I just was kind of like, oh my, here we go. Let's just start somewhere. And it does lead into what we're going to share a little bit later of the power of seeing people and doing something and planting seeds, because life is all about relationships and the trust that you build, and the universal language always being love. I say all that just because I just started volunteering in an orphanage, really not speaking. I didn't really have jack to do because I couldn't speak. And the girls taught me Spanish, all the girls in the orphanage. And my Spanish professor was totally blown away at these words I was learning. But the reason I share all that is everything starts with a seed of just, well, not quite sure what to do, but let's start here and let's love and let's build relationships and let's ask, not I'm here, you know, this is what I want to do, but hi, we're here. You're doing amazing things. Is there any way we could possibly help and support the wonderful things you're doing and work alongside? And from that grows different opportunities that expand into others and others. And it's the power of a seed. That's really all I wanted to say about that.
Noelle, you're still on.
Okay. Am I commenting on these? Okay,
No,
well,
you're talking about all the slides.
oh, okay, misunderstanding there. Okay, so, well, moving right along, this is our first youth corps in 2015. And I think we had about 700 volunteers and visitors come to join us during the 7+ years that we were there. And once again, it wasn't all about them just coming and seeing and walking away. It was, okay, if you have learned anything more about seeing people and loving people and walking with people like Jesus, then the real impact of this is how you go home and change your life and walk like Jesus where you are. So many volunteer corps, of which we helped in the orphanages. We started a library, all started with one book that now is all throughout Bolivia. It's amazing. The library program there really did start with one book, started with a good friend, Carla Armstrong, Carla and Chris. She said, man, girl, I'm coming down and I'm bringing you books. And she did. And that's how the library started. It grew and is now currently partnered with the city of La Paz and the city of El Alto, and is sharing and lending books throughout Bolivia. Okay. Just showing books. Everybody had a book. I had a book in your pocket all the time because in Bolivia, there's no lending libraries for poor children. In the hospitals, we worked really closely in one particular hospital, Arcoiris, where the kids and the moms and everybody had the chance to read books the whole time they were there, since they didn't have televisions, of course. As the English as a second language, which we started, this is in one of our, this is our Hope office And this was offered to the church and the community. It's a program that's still expanding right now, one that we're getting ready to introduce here into Atlanta. Bolivian English conversation clubs, connecting with those in Bolivia who are learning English. Okay. Just an example of when you see people, you know, it wasn't just seeing them as they came to centers, it was going to their homes and being with them and having tea and learning about them. And this is an example of one of the many gazillion homes where we would just go spend time with the mother, the daughter, the grandchildren. It's one of our park days that we had once a month where we had the church, the local church there is completely involved in connecting with the community of helping and encouraging. And we had a local park day where we virtually went and picked up, we'd have about 120 family members of the poorest of the poor that we were able to bring them to the park, teach the moms a little workshop, have the kids play with the volunteers. We all made sandwiches and a meal together and built those relationships that are still thriving today. Okay. I didn't see the slides. Okay.
Sorry. Oh, honey, you didn't see the slides?
Well, not all of them, but it's okay.
Sorry. So, I mean, the thing that Noelle talked about too was, you know, we didn't know Spanish. Well, our youngest daughter, Brianne, who's married to Nick, actually, we didn't realize it, but she had become fluent in Spanish from taking Spanish in elementary school, middle school, and high school. And so when we were thinking about going to La Paz, Bolivia, we took a couple of really special people with us. One of them was Lynn Ottenweller, Mark's wife, came, and this was before they were married, and she was with us for 6 months. And the other one was our daughter, Brianne, and poor Brianne became our translator, everything from going to the store to getting a taxi to working with Noelle and I. And so, you know, you can involve your family in things like this, and we definitely did. I thought I would just stop for a moment to see if anyone in the audience had any comments or questions before we went to our next section, which is about how to be aware of opportunities. All right. Peter, I guess that means we've got a Mark. All right, Mark.
Yeah, Kevin?
Yeah. Yes, Mark. Oh, you're muted, Mark. Or not. We can't hear you.
Can I ask a question while we're waiting for Mark to unmute?
Chris, go ahead. Yeah.
So I mean, that was so inspiring. I mean, I can't do it justice except by repeating that. It was just amazing. When people want to do stuff like this, what do you feel like is a good starting point? Just pushing past the fear? Is it getting on Duolingo and learning Spanish? Is it jumping into several things at once, picking up? I know for me, it was helpful for you to call me up and say, when are you coming to Bolivia? You said you're not here yet. And you said you'd come. But people have, you know, what do you think are good ways just to get rolling?
Yeah, great question, Chris. And actually, you're leading into our next section because we're actually going to very practically about, you know, how to get involved. And it really does start off with a seed. It starts off with an interest and small things. You know, we did small things in North Carolina where we lived, and then that graduated to doing small things in Africa, then went into, you know, something larger. And so actually, we're going to spend the next part of this talking about just exactly what you asked. So rather than say everything now, I think I'll walk you through it. But thanks, Chris. And yeah, sometimes you just get a phone call that says, hey, where are you? It's time to come. And it's safe, don't worry, and you'll be fine. All right. We're going to go ahead and move into our next section on awareness. And Peter, I'm assuming you're kind of looking for raised hands or whatever, and we can stop along the way if anyone has anything to say. You know, and we're going to start off, Mark. I'm going to give the mic back to you and let you do the first part of this section about awareness.
Yeah, I appreciate the question, and I appreciate the interest of the people on the call. I know you're from different backgrounds. I know you have different interests, maybe connections in different countries. So I'm going to kind of do a global kind of overview and give you some ideas, perhaps encourage you and spur you on to finding out more about opportunities and learning about global issues. So let's just kind of give you an overview, and then we'll talk about opportunities. Next. First of all, there's a lot of adventures in global health. That's a picture of Nelson Mandela that I took at his office. We gave an award. And so that's part of that adventure. There's the history and the culture and the social issues of any country. And I think we're really obligated to learn all about that. Probably my best source is the BBC. You can't always get news in America about issues. You can read about issues. I'm reading a book on slavery called Stamped from the Beginning. And, you know, you can learn about things, read about things, learn about these issues. But suffice to say, all these issues are interrelated. Health issues, you can't work on those alone. You have to understand a lot of the context socially, historically, and socioeconomically of the places that we either working in or want to work in as we go forward. Next. When it talks about global programs, again, these things affect us day to day: poverty, malnutrition, water issues, education issues. And we want to have a holistic approach that we can address health issues, maybe education, maybe malnutrition, but we may need partners to help us address water or other social issues or political issues. So we almost always partner with different organizations that have different abilities to address these different issues, because we want to have a holistic approach and do what we can, and then partner with other people that can help us to develop a holistic approach, because all these factors are interrelated. Next. I shared this before, that some of the challenges we face are man-made, and they can be due to tribalism, colonialism. The legacy of that can be due to civil war and strife. The top two pictures were from the Ivory Coast as the civil war was subsiding, but the fellow in the top left is carrying a rocket-propelled grenade, an RPG. And one of our church members was injured by an RPG, and could have been the same one. The bottom pictures are from Haiti during the earthquake. Shows the destruction, but also the tremendous needs as people were displaced. And so some of the challenges we face are man-made and some are natural, but we have to be prepared for a lot of different challenges when we go out and work in certain countries, especially in what we call the third world, the resource-limited settings. Next. As far as health, if you looked at global issues regarding health, certainly poverty is one of the main factors. Malnutrition is a huge issue around the world. About a third of the kids we help in Africa are stunted, and they've been malnourished, and that has a huge impact on their learning and growth and development. Water issues create diarrheal illnesses like typhoid and cholera and different things. And so we face those. We do need clean water or to purify water. There's a lot of respiratory issues: tuberculosis, pneumonia, viral pneumonias. I listed HIV and Ebola and COVID. They're going to be the sources of a lot of orphans. That creates another burden of disease and challenges for us to address on the health scale. So I think it's learning about these issues. I'll give you some resources in a minute, or people you can learn from. But the more we learn about those issues, the better equipped we are to come up with programs to meet the needs of the clients and the children we serve. Next. This gives you an idea about our programs in Africa that I worked on and helped develop. We started in Ivory Coast, that you see in West Africa, developed some big programs there, went down to South Africa, developed some Southern Africa programs, and with some large grants from the U.S. government, we developed programs in these 7 countries. The countries with stars on them, we have large volunteer programs, but very limited full-time staff, and those are areas of opportunities for development going forward. Next. So this is an issue that we address because as the epidemic evolved with HIV particularly, compounded by Ebola, compounded by COVID, we had lots of orphans. And so estimates 2019, there were about 17 million orphans in Africa. About half of the total number of orphans. They're orphans due to civil war and other causes. The total number of orphans is enormous around the world. Those are children who have lost at least one parent, and a number of children have lost both parents. And we have child-headed and granny-led households in a lot of countries where we work in. The needs of these children are comprehensive, and our programs were geared toward meeting the comprehensive needs of the child that you would meet with your children, all the way from health and nutrition, education to safety and parenting and exercise and emotional support, et cetera. And we can actually measure those issues and intervene and then follow the impact of our programs. Next. The parenting program, the biggest program we have now is early childhood development, where we help kids from 0 to 6. Primarily, we're intervening with their parents or caregivers on a large scale, and then providing kids clubs and play clubs and other sorts of interventions for the children themselves. And so we intervene with the parents and the children on a very large scale to impact their development. Like I said, we can measure a number of parameters through ASQs. Those are measurements of the different milestones that children go through. It's called ages and stages. And then we can measure parent-child bonding. We can measure parental stress, a number of different parameters that affect the health and welfare of the child. But that's an example, a very innovative program we've worked on a lot in the last 5 years, is early childhood development. Next. This gives you an idea about the programs that we developed. We started with HIV prevention. I developed a lot of models for community mobilization and engagement and partnership development in the community, literally mobilizing the whole community, which is something actually a lot of people have asked me about in the United States, about how we do that. So it's something probably neglected in the US. But then on those programs, we built care and support, home-based care. As we said, very large programs with orphans and vulnerable children with some big partners from the US government. Actually got over 5 years, $16 million to run those programs. And we helped 172,000 orphans over about 10 years with basic care and support. And then as the programs evolved, we did early childhood development on a large scale, layered onto our orphan program, focusing on the kids from 0 to 6. And we helped about 80,000 over the last 5 years with early childhood development. We also do some primary care clinics and some AIDS clinics as well in Africa. But this gives you an idea about the programs we developed and the impact that we had using some of the tools that I've described. Next. Yeah, this is important. What I do when I want to learn about programs and opportunities, I start on the large scale. I want to go with the big hitters. And so World Health Organization, the CDC, UNICEF are big partners that we work with. But those can be technical partners. You can go to conferences, you can get information, manuals, annual reports that they publish, and learn a lot about these issues from some of the global experts. And again, we've interacted, helped them develop some of those programs, and interacted with them on parenting and early childhood development, orphans and vulnerable children. But I would start with the big hitters and get as much information as I can from them. And then there's also networks. The OVC Task Force I've worked with in Washington for a number of years. And these are all these partners getting together and talking about issues of children. And so within certain fields, you'll have consortiums or symposiums or partners, and they'll frequently have large-scale workshops and programs to help educate you about some of those issues. Implementation partners are partners that get the work done on the ground and And so we work actually a good bit with World Vision, Save the Children in Care. And those are people you can work with and learn things from. And we share issues, we talk about programs, we help each other. Those are real partners that you work with to develop programs and implement those programs and have impact. There's also volunteer opportunities. And I really strongly recommend those because that's how you really get the face-to-face contact with not only the needs, but also the programs that meet those needs and the skills you have, whether you're a primary care physician or whether you're a nurse, whether you're just a good-hearted volunteer, to see the issues and see some of the solutions and some of the programs face-to-face. So I start at the top with the global partners and learn as much as I can and work down to partner with implementing partners and find opportunities to volunteer. Hope Worldwide has some of those with clinics and community programs and hospitals that Kevin and Noelle will describe. But I start at the top, learn as much as I can, and then focus down on where can I actually work face-to-face with those programs and learn about the opportunities where I can get involved personally. And so volunteer opportunities are critical to that. Let's go to the next slide. Also, partners are critical. These are some of our corporate partners. The fellow with the book, they help actually pay for that book that he's holding. That's Alex Cummings, the vice president of Coca-Cola. He recently retired, but some of these big partners have helped us a lot. We recently got a very large grant from a big toy manufacturer. I can't tell you who they are right now because they're going to launch that initiative. But you can find some great partners, whether it's corporate partners or whether it's technical or implementing partners that can help. And that's really key to our success. Next. Carol Gibson said that's her cousin, so she must be from Liberia. And maybe she knows where Old Road Joe Bar is, the battery factory and places like that in Monrovia. I've worked there a good bit, actually. These are some of the great people that have helped us. Again, you meet some cool people, and they're good-hearted people everywhere, whether it's celebrities or whether it's U.S. government people or whether it's people in the community. There are people that will come out of the woodwork and help you. And I found that out as well. If you build it, they will come. That's actually true. If you build it, they will come. Next. We also have single cores. That's just an example of working with kids. We bring singles out to Africa. They love working together and get to know each other. Next. We have volunteer cores. Those are live elephants in the background we took some pictures with. They would kiss you, but they wouldn't harm you. So those are people we work with older couples that came out and helped out as well. Next. That's my daughter dressed as Thor and my son dressed as Iron Man, son-in-law. And that's some of our grandkids. We had some big events for raising money and awareness for orphans in America. So that's also another way you can help is raising money and partnerships in the U.S. with sites in Africa and Asia and other places. So all of us can get involved in some way. All of us can help in some way. Next. So I just want to thank you for your attention and your interest. If you have questions, I can certainly, you can get hold of me by email, by text. We can answer some questions today, but certainly appreciate your interest, and we love to get more people involved. There's all kind of ways to get involved and a lot of great opportunities. Thank you very much.
So Mark, thank you. And Noelle and I will touch a little bit more on awareness in just a minute as well as we talk about different opportunities to be involved. But thank you so much for sharing with us your extensive experience from the ground up. And if anyone's ever witnessed the seed turning into a tree, I think that picture of the program in Africa really demonstrates that. I would pause for a moment to see if there are any questions from anyone for Dr. Mark. All right. Well, we'll go ahead and we'll finish up the last part of our presentation today. And we're going to talk about opportunities. And so Noelle and I are going to share with you some of our experience and some things we've learned through the years about how to become involved once you become aware of things. I do think that the phrase that's been used a lot, think globally, but act locally, is a very valid phrase because not many of us are going to get on a plane and go to a third world country and move there and serve there for 17 years like Mark did, or 8 years like we did. It starts with what you're doing at home. And so and you don't have to go overseas to Africa or Bolivia or any of the impoverished countries to be able to do a lot of good. And so I think that statement, think globally but act locally, is a very apropos for what we're talking about today. I love alliteration. So my feeling about becoming aware of opportunities is to become informed, as we've talked about, and then to be inspired, and then to become invited. So it really is up to us. We can become informed, we can become inspired, and then we can become invited. These pictures are showing healthcare professionals in different parts of the world serving, whether they're living there or it's a brigade or it's a corps, but it started with the seed that was planted in these individuals who went over, becoming informed, being inspired about the work and the people that are working there, and then becoming invited. And so that's what I'm going to talk about. So as Mark alluded to, what are some ways that you can become aware of things? Certainly, many of our academic healthcare institutions have global health programs. And in these global health programs, they have a section for news, and in that they tell stories about what's happening that they're aware of or they're involved in all over the world. And so that becomes a way that you can become informed. Another way to become informed is, I'm a member of the American Academy of Family Physicians. There's a student global health interest group. You don't have to be a family medicine doctor or even a family medicine student to be involved in that group. You can just be a student, and you can learn what's happening. So in this year in October, there's going to be a big summit. And as Mark talked about, these summits are incredible opportunities to learn what is happening all over the world. What are the issues? And then you'll find yourself being drawn to something that is significant for you. Nonprofit organizations like the World Health Organization, Mark mentioned this, it's very true. The World Health Organization has more information than you can sift through in any given day about what's happening all over the world. Another of our favorites before we went to Bolivia and before we started thinking about other places is the Cia.gov World Factbook. This is a powerful, powerful tool where you can actually look up any country in the world and you can learn about their economy, their social challenges, their government, the healthcare challenges, literacy, you just name it. You can learn everything you possibly can about these countries, and with references so that you could dig deep. But every country in the world is open, and this is a very reliable source of information, as you can imagine. It's a way that we learned a lot about Bolivia before we moved there. It's a way we learned about Kenya before we started serving there. It's just a great resource. Another part of that is being inspired. And, Mark, just a quick personal story. Mark is really the individual that I'd say who's inspired me most in my life to do the things that I've done. You've heard Mark's story, and Mark's just a few years older than I am, but yet he's still got all of his hair. I don't know how that happened. But he you know, his work, I became aware of Mark as a doctor when he was here in Atlanta before he went to Africa. And he invited people to professional seminars. And I'd hear about his work even here in Atlanta, how he was reaching out and loving the patients that he would see and the work in the communities here. And I became inspired by Mark. And then I kind of followed him. I kind of stalked Mark through the years. We became friends, but I watched and heard about his work in Africa and Abidjan in South Africa. And then in 2004, became more intimately involved in the sense of going down to South Africa and then being led to Kenya, where my family and I served for many years off and on in Kenya. And so Mark is one of my heroes. He's one of my mentors. I wound up working for Hope Worldwide, which is the organization that Mark worked for, because of just the influence that Mark had. I just thought, I want to work for Hope someday. And I had the opportunity to do that. And so I think it's important to identify and find heroes and mentors that inspire you, because trying to throw yourself out there to do something globally or even locally can be kind of scary, as Chris and I were talking about when he asked that question. But when you've got mentors and heroes, actually it helps you to be braver about things. I certainly would have never gone to Kenya or to Bolivia if it hadn't been for the influence of Mark. And while going overseas, I got a chance to do things like meet Dr. Hayner, the bottom left there, who is an amazing surgeon who has devoted her life for working with Hope Worldwide in Cambodia at the hospital in Cambodia that I'll tell you about in a minute. And she's the medical director of this hospital. And she is just an inspiring person. If you've never met Cornelia, you have got an inspiring person to meet. And because of the work she does, the love and compassion she has for people, the teaching, the way that she's been able to just create with a group of dedicated volunteers, a light shining in a dark place there in Kampot, Cambodia. So become inspired. You know, I was also inspired just by the work of Hope Worldwide. You'll hear a lot about Hope. We're definitely biased, Mark and I, because we work for Hope. We've donated to Hope, and we've volunteered for Hope all these years. And so our conversation today is a little Hope, biased, but Hope was our opportunity to find out what's going on in the world. They've got, a webpage that talks about what's happening all over the world again. So, and with some inspiring stories of just regular people, like Scott and Mary McNair, who are going to be moving to Cambodia to serve there from Massachusetts, and you get inspired by reading about stories of people that go and they do things. And then being invited. And when I say become invited, all you got to do is sign up. You sign up and you will be invited. So Hope has a volunteer page where you can join the community of volunteers, and that's volunteering in the United States for things that are being done. It's volunteering for volunteer corps. It's volunteering for health brigades. There's a lot of things that you can volunteer for. And so, you just sign up. I want to join. There is a global health network. When I worked for Hope, I've now, volunteered for Hope, but when I worked for Hope, we began a global network. And in this global network, we've got a mentoring group. We make people aware of opportunities to serve, in health overseas and in different areas. And so again, I kind of take us back, and I love this verse in 1 Corinthians chapter 3, verses 6-7, where, we can plant seeds and they can be watered, but God makes it grow. And what you've seen through mine and Noelle's life, and from Mark's life and Diane and Lynn, is that it started out with a small seed, but then that seed grew. And what God can do is pretty unlimited. When you look at the reach and the depth of the work that was started with the small seed, it's absolutely inspiring. And so start small where you are. We started out with a local chapter in Durham, North Carolina, doing some things around our city. And then we did every other year 10-day trips to Africa for about 5 of those trips. And then we wound up moving to Bolivia. Bamboo is a grass. It takes 7 years for the bamboo to germinate, but it is the fastest growing grass in the world. It can grow 1 meter or 3 feet in 24 hours. So, you know, once it takes off, you never know where it's going to end up. Now, I want to give Noelle an opportunity just to share from her perspective what she's done locally. She did things locally in Durham, North Carolina. She did things locally in La Paz, Bolivia, in developing the social programs and starting a foundation there. And she's now doing things locally here in Atlanta, Georgia. As you can see, it doesn't matter where you live, you bring yourself with you, and the things that you do, you will do wherever you live. And that's the beauty, I think, of being transformed to think globally, but act locally. And so I'm going to turn this over to Noelle. Oh, wait, Noelle, just one moment. So this is the Community Service Brigades, Honduras, Guatemala, El Salvador, Tijuana, Jamaica. For those of you who are healthcare professionals or even just volunteers, especially if you speak Spanish, it's a great opportunity to go for a 5-day trip to one of these places that's been well thought out, very safe, and an incredible, transformative, and meaningful experience. The other opportunity, as I was mentioning, was the volunteer course. Unfortunately, as you can see to the right, there are a few of these that have been canceled because of COVID, but they will be opening up again. But I showed you that slide to show you all the places in the United States as well as all over the world where you can volunteer. You don't have to be medical. These are non-medical corps. And then here's Dr. Hayner again, and here's the hospital in Cambodia. If you're a specialist and you want to use your skills, a great place to use your skills is a hospital with specialty clinics like Cambodia overseas. And you can find yourself as a cardiologist using your skills, or an ENT surgeon, or as a specialist, or primary care. All right, now I'm turning it over to Noelle. Noelle, please tell us a little bit about being aware every day and seizing the opportunities around us.
Wow, this is great. Kevin, how long do I have? Just 5 minutes? Is that good? Or
Yes, Noelle, it looks like it's about 11:46. We end at 12 o'clock. And so
okay,
we've got about
just
14 minutes. We'll open it up for some questions at the end. So yeah, about 5 minutes or so, a little bit more if you want.
okay. All right. So that translates to an hour. Here we go. All right. So, but you know, I am not speaking or sharing at all as a medical professional. I'm sharing as just a everyday person that just wants to be like Jesus walking through the world. And everybody gets to do that. And like, you know, the passage in Matthew, and you can read all through the Gospels, Matthew, Mark, Luke, and John, you know, when you get snapshots of Jesus, or maybe to use the word selfies of Jesus, right? Holy Spirit wrote these selfies about Jesus so that we could like them every day. There's 4 billion likes happening on social media every day. How many of those are looking at Jesus? And, you know, the world is crying out to see heroes and saviors. Honestly, they're really crying out to see Jesus, and we get to be like him on an everyday basis. So Mark talked about themes, or I call them bedrock scriptures, bedrock themes that guide your life. And I love what Mark quoted from Isaiah 61, because in Luke 4, that's how Jesus introduced himself to the world. He said, let me read from this, that I'm here to heal up the brokenhearted, to tell them how beautiful they are, so that they in turn will go out and change the world. And it is true that loved people love people, believed in people believe in people, respected people respect people, and encouraged people encourage people. And Jesus introduced himself to the world in that passage in Luke 4 and said, today, you're going to see me live like this and love people like God. And that's probably one of my bedrock heartbeats, is today we get to introduce ourselves to the world wherever we are. And the other bedrock truth is planting seeds and not boulders, and seeing people and doing something. So everyday awareness. I think we steer where we stare, right? If you stare, we become like who we spend time with. We become like our heroes. So for me, it's just a passion to spend time in the Gospels every day so that I've got snapshots of Jesus in my heart. And when, you become like who you spend time with, you see people like who your heroes see people, and Jesus saw people. So many of the scriptures that you'll read talk about how he saw someone, found their eye, knew their story, and was filled with compassion and did something. And that's what we get to do every day, is to see people. There isn't a person that we wouldn't love if we knew their story, right? So whether you are a medical professional, whether you are a teacher, whether you are a student, where you are in your body is exactly where Jesus is that day, wanting to reach out and love. So who's ever on your left and who's ever on your right, you were meant to plant a seed. And not, you have to plant a seed like, oh gosh, what a burden, but we get to. And so see people like Jesus. Wow, people are amazing. They just don't know they're amazing, and we get to plant a seed. You start where you are. Like, you don't have to get in a plane and go somewhere to change the world. We change the world from right where we are. And that old phrase, you can't change the whole world, but you can change somebody's world somewhere. When you help encourage one life, that in turn turns around, encourages a family, encourages a community, and changes the world. So start where you are, because where you are is where you're meant to be at that moment. And so back, can you go back just to the seeds real quick? And then I promise I'm going to rush through the rest. Kevin's panicking. I'm going to take too long, I know. But start where you are, embrace every opportunity. Is just wherever you are is where you were meant to be. And you may not be able to do a lot, but we can plant a seed, and that builds trust. That life is about relationships and connections. And so the big mantra in my life during the past 20 years has really been to plant seeds, not boulders. Seeds are small, seeds are smiles, seeds are finding people's eyes. Because when you connect in their eyes, then you're connected in your heart, and then you walk away and the head thinks and the heart feels where your feet were planted. It's like, what could we do in that situation? I'm not exactly sure, but so connecting for their eyes. And seeds are small, like smiles, encouraging words. Hi, your child is beautiful. Wow. Hey, what do you do? Oh, wow. Gosh, thank you for teaching me that. That's really cool. Or just encouraging words. Boulders are what stops us because we think we have to have the solution for everything. Like boulders are, oh man, there's too many people around. If I just do this one thing, does that really make a difference in the world? Boulders are, oh my goodness, I'm afraid. What if I say the wrong thing? What if I give them some money? And what if they ask for my phone number? And then what if I see them again and I don't know? Boulders are giving into fear rather than God just wants us to plant a seed. And again, as Mark 4 and Matthew 13 says, God's the one that makes them grow, even while we're sleeping at night. He's the one that makes them grow. And so now, and what seeds has come to mean is just see people and do something. Just imagine if all of us were, all of us just saw people and did something wherever we were every day. And those seeds continue to grow as somebody else comes along and waters. Okay, you can go to the next one. Thanks. Now we'll fly through these slides. The other thing that I love, I love this little photo, is just because I just swung one little kid in the air and all of a sudden I had a line of 82 waiting to be swung. And I'm like, oh my goodness, help. Sometimes we're overwhelmed by crowds, there's too many needs to meet. And I love this about Jesus too, is that Jesus was surrounded by crowds, but he always saw the one. And there's so many stories I could just tell. Maybe this gentleman right here that's missing his leg, like I lost my leg to cancer, and somebody said, Noelle, can you go meet this guy? Well, not only did we become the best of friends, and he later was baptized before he passed away of his his tumors, but that connected us with, in Bolivia, it connected us with hospice, which connected us with a million other opportunities, just because you see the one. And life is about relationships. Again, there's a passage in the Bible in Acts chapter 3 where there was a beggar, and Peter and John happened to be going to the temple at the same time. And he looked at them, and Peter said, "Look at me, look at me." And for that moment, the man was seen, and he's like, Peter said to him, "Silver and gold I don't have, but what I have, I give you." We always have love to give people. And that one act of kindness ended up changing that whole world around them. So the power of seeds. Let's see, the question is, what do I have? And let me just give what I have. I love this little visual right here because, one example of starting in Bolivia was just, we realized that there was no books to lend children, and the power of books to pull families together. And so we started with one book, then we had 10, then my friend Carla brought 200, and then the embassy gave us 500. And now we have a library with well over 5,000 books that we lend all throughout Bolivia. And so that was just an example of seeds and how they always grow, right? Just start with one. Go there. What I mean by that is just go there, go for it right where you are. Go there right where you are. And so there's a million stories to share about Bolivia, but we're in Atlanta now. And so that was just like, okay, I'm working with the campus students. Where right around us can we help and serve? And we started with the homeless. We started with different organizations that were helping with children. Then COVID hit, we had to cancel everything. So we kept up relationships by doing volunteer video things. And now we have just continued to develop, if you go to the next slide, we continue to develop just a ton of initiatives, even during COVID when we can't even see them, but just by, okay, go there right where we are, that I'll plant a seed, the college students plant the seed, adults plant a seed, but God is the one that makes them grow. And so we're just starting this initiative right now of our care packs, where everybody in the church will make the individual care packs to have stored in their car at the first of the month. We restock. We write encouragement cards, care cards. We have connection cards connecting people to local resources that are experiencing homelessness and crises. We now have a little Hope Depot at the church where we can store things, and things come in and things go out. And all these relationships that we've never been able to physically serve once during this year of COVID, we've become such great friends that they're giving to us $8,000 worth of donations of kids' books, kids' clothes, kids' pajamas, kids' this, kids' shoes, kids' coats, and we're all working together. But it just starts with seeing where you are and planting a seed where you are, and not worrying about how it's going to grow, but just have fun that we get to be like Jesus and let God do the growing. Okay.
Thank you, Noelle. You guys can see where I get my inspiration from. Anyhow, so that's the end of our formal presentation, and I know we're about out of time, but maybe Steve or Peter or someone, you might want to end us out here if you don't mind.
Just a quick request. This is incredible. It's very humbling just to watch all of this and to try to take all this in. You guys are superstars and such an inspiration, and also so approachable. I just love the way that you put those think globally, act locally worlds together. And just thanks so much for all that you've shared today. And I've filled up my page with writing on it, and I really want to take time to go back and think how I can get more involved globally and locally, both. I think I'd love just to hear, just real quickly though, just some of your perspectives on what we've just been through and what we're going through with the pandemic, because the global and local has come right to our homes, and it's very real for all of us. And I think I'd love just to get your perspective on how we can respond, not just for ourselves, but for our neighbor, locally and globally, with COVID in mind. I know both of you have been very involved with directing sort of the COVID response in Atlanta. You in particular, Kevin, and so could you guys speak to that just for a moment, as to how you kind of see this as an opportunity and how you see us coming out of this pandemic, not kind of going back to old ways, but maybe developing some new habits and thoughts about how to love our neighbor as ourselves coming through this.
Mark, you want to?
Yeah, certainly. I appreciate the question. I think praying about the opportunities. I think studying about helping other people, helping the poor, and then connecting with people. Anybody on this call could give me a call or send me a text or an email. Connecting with Kevin and Noelle, connecting with people. They can give you ideas and discuss opportunities about how to help the people right there in Burlington. And at the same time, have a separate focus of a site somewhere in the world that you could adopt and get involved. Or a group that wants to do that. I did look up the medical school site. They did talk about global health concentrate, I guess is what it described. But anyway, there are global people probably there in Burlington that can also give you some ideas. But I would try to have a local site, and I'd probably have a global site that I'd got interested in and learned about and made an opportunity to adopt and get involved.
I was going to add,
Kevin would, I'm sure, too. Noelle.
yeah, I was going to add to that, Steve, that I feel like what COVID has done for me. I mean, I am on the ground. I'm seeing the patients. I've been rounding in the hospital as well, and so I've definitely been face to face with COVID. But you know, what we've seen is that, you know, it's created a lot of fear. It's created a lot of isolation, but I think the positive side of that is that I've actually had a little bit more time to kind of explore what's happening. I'm certainly more aware of what's going on in the world because of COVID, you know, and different places in the world that are being affected about COVID. I'm definitely more aware of what's going on in my community because of COVID, you know, and in the United States because of COVID. And so I feel like that COVID in some ways made me more global, you know, in a sense. It's also given me a skill set I didn't have before, which is kind of internet skills, if you will. I mean, you know, running the Zoom call, you know, and that has actually made me aware that you don't have to be in the same place to communicate. We've been talking to people in La Paz, Bolivia, and we've been talking to people. Noelle talked to someone from Africa yesterday, and Mark does that all the time. And so in some ways, the pandemic has made our world smaller. It's certainly made us all aware of how human we are and how vulnerable we are. And yet it's made us realize that with that we are closer than we thought we were, and we're more connected as that way. And so this is a great time to do the research on what's happening in the world while you've got the time and to be connected.
Yeah, I think workshops and seminars like this are great to connect people. This last year, we did a whole series. This is kind of a family group, Bible discussion group. We did a whole series on social justice. We did a whole series on COVID. We did a whole series on emotional and psychosocial support. And so we attracted a lot of interest and got a lot of people involved. We'd have 14, 15 of our friends coming to these get-togethers because we really met very apparent and glaring needs. And so I think there are needs out there that people still want to respond to. One series on social justice, a woman in our Bible study group who was a lawyer, who's African-American, got 5 of her friends on the call talking about justice. It was fantastic. But I think if we really meet needs and we really address those in a assertive, dynamic way, people really respond because there are a lot of needs still out there.
Thank you so much. If it's super helpful, and I think it's just stimulating in terms of thoughts and ideas and creativity, and you know, and using our gifts to serve. I think that's the thing I'm most impressed about with you guys is just your dedication and your intentionality around using your gifts to serve and using the small moments as well as the large opportunities. And I think we've all got gifts to give. We've all got things that we can offer the world around us. And I love your point in the sense of saying, you know, we are more aware than ever of our global community and how much a smile makes a difference, because we haven't been able to see a lot of smiles through the masks, or how much a kind word makes a difference, you know, and these kind of things. And I just, I'm really hoping that we can be, I don't know, more aware, more connected, more kind to one another because of what we've been through together. And I think times like this are very helpful in terms of just helping us to move forward and to not give in to fear, but to have the courage like you have. Those especially who've spoken today, it's just inspiring. It's encouraging. It's comforting. It's motivating in terms of just taking some of those next steps. And so I just want to say thanks so much for that. I'd love for you, if you guys could put in your email address in the chat, because I would like for this group, if you guys are willing to reach out with questions. We do want to be mindful of time, and this has all been recorded. We're going to put this on our YouTube channel, on our website, and we're going to go back to these recordings just to kind of digest it all and come up with some real plans where we are. And it's such an honor to have you here in Burlington with us, and it's an honor for the Burlington Church of Christ to host. And I just feel, Sue and I both feel like we've talked about how we feel a little bit like we're at a wedding, and we get to introduce our family to our friends, to our friends, to our family, to our, you know, new friends, new family, new acquaintances. And it's just really a thrill. Thank you so much for just the presentation today. It was so thorough, so well done. And thanks for your service and your lives. You guys are incredible.
Mark, thanks for staying at Starbucks all this time.
That's right.
They give me free coffee.
Mark?
I hesitated, but I figure people need to hear the story anyway. So they come and go and they hear what I'm talking about. So it's a community interaction right here at Starbucks. I think that's their goal, to build community. So I'm building community right now.
Well, you look like
Thank you guys so much. Thank you for all your.
Yeah, I love you. And so we're going to have our next session here at 12:30 to 2 with the Williams, with the Sharon.